Hello, this is Dr. Stanley Lang, and welcome to this broadcast. My question for you today is, what does breathing have to do with stress management? And the context for this question is a whole person approach to health of body, mind, and spirit that we're pursuing in this series of broadcasts. The question today is dealing with breathing, which overlaps on the physical and the emotional parts of this triangle. Now, obviously all of us breathe. The question is, how does breathing affect our stress levels, and can we do anything about breathing that makes us less stressed or more stressed? So there's a lot of different things that we could talk about breathing. I'm just going to focus on one major thing that I often share with patients, because I often see patients who are under a lot of stress and are feeling anxiety from that. It's very common for people to easily hyperventilate through the day because of the stress that they're feeling. The anxiety, the worries that they're having cause them to breathe more frequently, or more commonly cause them to sigh more frequently. So each one of us have sort of built into us the ability to sigh, which is like taking a really deep breath, that is supposed to happen unconsciously, that allows us to fully expand our upper lungs periodically, occasionally, so that those upper lungs don't collapse. Because we don't need all of our lung capacity most of the time when we're just doing normal activities. We just need that full lung capacity when we're doing a lot of physical activity. Well, it turns out that what happens in a lot of people when they are under stress, under chronic stress, is that they will do this sighing breathing, this deep sigh, more frequently per minute. They may sigh 2, 3, or 4 more times per minute than the usual person. And one of the symptoms that a person is hyperventilating is sometimes there's a little slight chest pressure, sometimes there's a tingling around the mouth, just feeling a little bit more jittery could be a sign that the person's hyperventilating. Or a stronger sign would be that I feel like I can't get my breath, and that's almost always a sure sign that I've moved into this area of hyperventilation. And it's funny, the body for some reason messes this signal up. When we start breathing too much, too fast, too deeply, we make our carbon dioxide levels drop, and the body misinterprets this and thinks that there's something wrong and we're not breathing enough, so it causes us to breathe more, which makes the problem worse. The carbon dioxide level drops even more, and I feel like I can't get my breath. And so that's why people often will have a panic attack and they can't breathe because they're hyperventilating so much. So we can sense this way on early in the process if we're feeling just a little bit nervous or anxious. And one of the techniques that I teach my patients is to slow your breathing down consciously to 4 breaths a minute. So you can breathe in and out over 15 seconds. You can structure that any way you want to, but I just tell people to breathe in slowly and exhale slowly, and to be looking at their watch or some second hand on a clock for 15 seconds per breath. And it's amazing how well we get by with just 4 breaths a minute. Now, obviously, you're taking a really deep breath compared to your usual breathing, but you will be able to easily get by with 4 breaths a minute if you've got normal lungs, if you don't have lung disease. And what will happen is, over a period of 5 minutes or so, the carbon dioxide levels will drop down and you're going to feel a whole lot more peaceful. So this is a good example of how the physical part of our being overlaps with the emotional part of our being. And while I may think that my thoughts are somewhat separate from my body, my thoughts and my emotions are very much governed by the chemistry of my body, which I just affected by how I'm breathing. So I can very consciously slow my breathing down to 4 breaths a minute, breathing in very slowly and exhaling very slowly. Now, there's some other things I'm going to teach you later that we can do at the same time that we're doing this breathing. And you don't have to wait till you're feeling really nervous to start doing this. You can do this many times a day. Just consciously slow down what you're doing and just stop and breathe slowly for 5 minutes. And focus on this, really breathing in slowly and exhaling slowly. and it will cause you to relax more. So that's the overlap between breathing and stress management. I hope this has been helpful to you and that you're able to practice it occasionally. Please share this idea with friends and family and subscribe to this channel so that you can get updates on how to be healthy in body and mind and spirit. Have a good day, and God bless you.